So it would seem to me that the pro-forced birth movement has no idea the incredible amount of effort it takes to keep a brain-dead body functioning. From the comments I've been getting and the DMs I've been getting, I think y'all think that the patient is just sleeping, and that's not the case. So as a doctor who takes care of brain-dead patients in the hospital, I'm going to talk to you about what's actually involved in that process to help dispel some of these misconceptions. And if you happen to be pro-choice and are watching this video, make sure you share it far and wide so it gets to the intended audience, okay? Let's get started. So once a patient is declared brain dead, which is an entirely separate process that I'm not going to get into, but after that process takes place, the medical team now has to take over all of the bodily functions that the patient can no longer take care of themselves because their brain doesn't function anymore. So one of those things is breathing. Now all these patients will already have a breathing tube down their throat and hooked up to a ventilator. However, we can't keep that breathing tube in permanently, right? After 2 weeks, we have to take it out because it can cause a lot of issues. So what we'll do is make a surgical airway. We'll make an incision in the throat right here and put in a tracheostomy tube and then hook that up to the ventilator. And then the ventilator does all the breathing for the patient and we can adjust it as needed. How many breaths they take, how deep those breaths are, how much oxygen they get, etc. We're also responsible for maintaining the homeostatic balance within the body because the brain can no longer do that. That means giving medications to make sure things like the temperature, blood pressure, and heart rate don't go too high or too low. We maintain it in a normal range. There's often a lot of hormonal imbalances that come in patients with brain death. For example, one of them is something known as central diabetes insipidus. So that's the patient can no longer absorb water from their kidneys, so they just put out liters and liters and liters of very dilute urine and they become very dehydrated and their sodium levels start to rise. So we have to artificially hydrate them and give them a hormone known as desmopressin to help reverse this. And obviously these patients can't eat, they can't swallow, they can't chew, so we have to put a PEG tube, which is a feeding tube, in their stomach and hook them up to tube feeds and then give them their nutrition that way. And these patients require tons and tons of round-the-clock nursing care just to take care of the things that you would take for granted, like brushing your teeth, cleaning yourself. Every time they have a bowel movement, they need to be cleaned. They need to have lubricating eye drops put in so that their eyes don't dry and they get corneal ulcers. So those are just some of the basic things we have to do every single day just to keep the body functioning, let alone the myriad of complications that can arise from being bedbound and brain dead in an intensive care unit. So what are those complications? Well, infection is a big one. And depending on the medical devices the patient has can inform their infectious risk. So for example, if they have a central line for medications, they can get a central line infection and a bloodstream infection. If they have a Foley catheter for bladder decompression, they can get a urinary tract infection. But a lot of these patients will get what's known as a ventilator-associated pneumonia, which, as the name suggests, is a pneumonia because the patient's on a ventilator. And they're going to keep getting those pneumonias. And every time they get a new pneumonia, there's a risk for breeding a multi-drug resistant bacterial infection, and we have to use stronger and stronger antibiotics every time. And the stronger the antibiotic, the more likely there will be side effects. And then we have to treat those side effects as well with more medications. And even with the best nursing care and the best occupational and physical therapy, the body is going to start to break down because all the artificial support we give is no substitute for just normal bodily processes. So the skin will start to break down and ulcerate and get infected. The limbs will start to atrophy, the muscles will atrophy, the limbs will start to contract, and this can go on for years if the patient's underlying health status was good before they became brain dead. Now I know this is a long video, so I'm gonna wrap it up. But the thing is, sometimes patients' families want this for their loved one, and we will honor their wishes. We will do it. We have the capability, we have the technology, and this is why we went into medicine, to help people, to help families. But there are families who don't want this. They don't want to see their loved one suffer like this. So they withdraw care, and all that stuff that I just said, we just stop and allow the bodily processes to cease. But the important thing is, we honor the family's wishes. And that's what I don't think you're getting right here. The family in Georgia does not want this, but they're forced to do it because of the law that you championed. So I hope this video helped.